So, friends, welcome once again. I am today with the new topic, and that is the dysentery, another sign and symptoms which we have to face into the GIT disorders. So, let's see what are the objectives. So, objectives of the today's session are the definition of the dysentery, what are the types of the dysentery, then we move with the specific type, what are the clinical features, which investigations, and the management. So let's start our first objective, that is the definition. So what is the definition of the dysentery? So dysentery is an inflammation of the colon and the rectum, right? So the in the dysentery, the small intestine is not involved. So involvement of the colon and the rectum. So there is inflammation. So characterized by the tenesmus. Yesterday we will talk regarding the tenesmus and the passage of the frequent stools contain the blood and mucus. स्टूल के अंदर blood आ रहा है और साथ में mucus भी आ रहा है, उसको हम dysentery बोलेंगे. Which are the types of the dysentery? So there are the two type of the dysentery. First, that is the bacillary dysentery. Uh, in that, that is the bacterial causes, and second, that is the amoebic dysentery. In that, there may be a protozoal causes, right? So let's see the first, that is the bacillary causes or the bacillary dysentery. So in the basically bacillary dysentery, it is done happen by the bacteria, right? So let's see which are the different etiology of the bacillary dysentery. So the etiology of the bacillary dysentery are so it is caused by the infection of the wall of the large gut by the species of the bacteria, especially the genus Shigella. And such infection may lead to the acute dysentery with the passage of the blood and the mucus, or diarrhea, or to no overt symptoms at all. So symptoms नहीं भी हो सकता है और साथ में ब्लड पास होता है और म्यूकस के साथ पास होता है और डायरिया भी आपको दिखाई देगा. So this is the etiology of the bacillary dysentery. So the acute disease is characterized by the severe colitis. Colitis means itis means inflammation, colon ka inflammation with the diarrheal feces. So the consistency of the stool will be changed, frequency of the stool will be changed. So in the yesterday's last lecture, we already talked what is the definition of the diarrhea, which containing the blood and the mucus, and at some stage epithelial debris and the pus are also present. So उसमें क्या होगा, साथ में पस भी होगा और म्यूकस डेब्रिस भी होगा और ब्लड भी दिखाई देगा, म्यूकस भी दिखाई देगा. So very common, that is the IBD. Yesterday we talk about it, IBD, right? Infection result from the swallowing of the organism, usually into the dirty food or the water which has been contaminated with the human feces containing bacteria. So this is the fecal-oral infection. So feces to oral. So contaminated food or the contaminated water, because the person who is suffering from the bacillary dysentery and that person passes the bacteria in their stool, and their stool is capable to spread the infection into the normal individual. So this is the uh, dirty food or the dirty water or the contaminated with the human feces containing the bacteria, right? So this is the fecal-oral route infection. Remember one thing, bacillary dysentery is happened by the fecal-oral route, right? There are the four group of the Shigella are the recognized. Uh, First, Shigella dysenteria. Second, that is the Shigella flexneri. Third, that is the Shigella boydii. Fourth, there is a Shigella sonei. And the most severe form is a Shigella dysentery. It is a founding into the backward countries, right? Backward country में बहुत दिखता है और वो बहुत common है, just like in Africa. So let's see which are the different symptoms and the signs which may seen into the bacillary dysentery. So the acute attack follows an incubation period of the variable length, which is commonly not more than the 3 days, but maybe as long as a week or as short as a few hours. Acute attack आएगा because it is depending on the incubation period of the Shigella bacteria, but not commonly more than 3 days. 3 दिन से ज़्यादा incubation period नहीं दिखाई देगा. So वो आपका साइन एंड सिम्टम्स का जो सिवियरिटी रहेगा, अपीयरेंस रहेगा, वो एज अ वीक और द शॉर्ट एज अ फ्यू आवर्स, आधे घंटे में भी आ सकता है. द ऑनसेट the onset is a sudden with the gastrointestinal discomfort and the acute diarrhea, sometimes with the nausea and the vomiting. Onset sudden होगा, gastrointestinal discomfort भी दिखाई देगा और acute diarrhea sometimes with the nausea and vomiting is a कर देगा. Right? The first motions, the first motions are the watery and contain some fecal material, but they are soon replaced by rapidly by the characterized frequent motions consisting of the blood and the mucus in the small amounts at a very frequent interval. Right? So this is the progress of the dysentery. So first motion is a watery diarrhea, and then it contains some fecal material, foda foda dekhai છે, and they are soon replaced rapidly by the frequent motion with the bloody diarrhea or the mucus diarrhea. It happens into the small amount, but the frequency is very much more. So a very frequent interval patient has go to pass the stool, right? The passage of the stool is urgent. Suddenly उसको defecation reflex आएगा, suddenly भागना पड़ेगा with the tenesmus and the severe gripping abdominal pain. Patient says like बहुत दुखता है, severe gripping abdominal pain. The abdomen is very tender over the area of the large bowel. So large bowel area is this is the large bowel peripheral area. So the abdomen is very tender over the area of the large bowel, right? The number of the stool pass by maybe a 30 to 40 per day. 30 से 40 बार वो स्टूल होने जाएगा. At least they usually exceed 20. 20 से तो ज्यादा रहेगा. Usually remittent moderate fever accompany, remittent type का fever रहेगा moderate, and the untreated cases, the acute phase persists for about a week and then gradually subside. एक्यूट ट्रीट नहीं करेंगे तो भी वो एक्यूट फेज एक वीक तक रहेगा और बाद में अपने आप सबसाइड हो जाएगा. राइट? Some cases are very severe and the fulminating and the death may occur in a few hours or the days because the severe diarrhea can causes the water and the electrolyte imbalances into the body. So if we are not working properly, treat properly that case, it may be converted into the death. The most serious cases are associated with the Shigella dysentery infection in which there is a toxemia. So due to the infection, the WBC will be increased, and that WBC can causes the toxemia, septicemia. So due to that toxemia, the patient may goes into the serious condition, and the death may also occur. Right? So I hope you can easily understand what are the signs and symptoms of the dysentery. Now let's see what are the differential diagnoses of the bacillary dysentery. In the bacillary dysentery, we are talk about differential diagnosis only one, that is the amoebic dysentery. So bacillary dysentery common into the children, amoebic dysentery less frequent into the children. Bacillary dysentery depress ulcer into the lower end of the ileum. Amoebic dysentery deep round ulcer with the rise edges into the cecum but never into the ileum. In the bacillary dysentery, stools are the very frequent, scanty, mucus viscid, non-offensive, bright red blood, alkaline into the reaction. In amoebic dysentery, less frequent feces, feces का frequency कम हो जाएगी. Stool was bulky but offensive, smell रहेगा, and the blood is a dark blood and the mucus and it is acidic into the reaction. In the bacillary dysentery, leukocytosis only into the acute stage. Into the amoebic dysentery, usually leukocytosis increases with the liver abscess के साथ में liver involvement होगा तभी वो leukocytosis दिखाई देगा. Bacillary dysentery incubation period a week or less. Amoebic dysentery incubation period from 15 days to a few months. Bacillary dysentery onset is acute. Amoebic dysentery, the onset is often insidious. Right? We see the other difference are also in the bacillary dysentery, fever is a common. In the amoebic dysentery, fever is a rare. In bacillary dysentery, abdominal pain and tenderness is severe on the left side. In amoebic dysentery, pain is a variable and may be localized on the right side. In bacillary dysentery, tenesmus is usually severe, and in amoebic dysentery, tenesmus is less severe and often absent. In bacillary dysentery, there is a risk to develop the toxemia and the exhaustion periodically. And into the amoebic dysentery, exhaustion and the complications came periodically. And the last difference in the bacillary dysentery, complications are the few, but into the amoebic dysentery, there is the risk to develop the peritonitis and the hemorrhage, hepatitis, and the liver abscess. They are most common causes of the complications of the amoebic dysentery. So I hope you can easily understand which are the different differential diagnosis of the dysentery. Right? Now let's see which are the investigation and how can we diagnose the bacillary dysentery. So clinical diagnosis is in the well-established case is obvious and should be based on the frequent passage of the small stool containing microscopic blood and the mucus. So we can make the diagnosis that is the bacillary dysentery. Which complications happen due to the bacillary dysentery? So first, that is the early complication. So acute circulatory failure हो सकता है, nephrosis, arthritis or the toxic origin which affecting the knee joint, acute conjunctivitis and the peritonitis, and the sometime the parotitis you may also found in the case of bacillary dysentery. Right? As we see the complications, so after a few times the late complications are also occurs in the bacillary dysentery, and they are the hemorrhoids. Sometimes the arthritis will be developed and the eye complications, and the nephritis will be we can see as a complication in the case of bacillary dysentery. Right? Now let's see what are the prognosis of the bacillary dysentery. So prognosis is a depend on the virulence of the organism कि organism का virulence कितना है, कितनी quantity में organism है. It depends on the susceptibility and the constitute of the individual कि individual का constitution कैसा है, how in how many time how much time we can diagnosis, early diagnosis, the prognosis is good, and which we give the treatment, the efficient treatment. So these in this all cases, so if there is a virulence of the organism is a low, susceptibility is a more, and the constitution is a good, and the early diagnosis and efficient treatment have a good prognosis. And in the cases of the Shigella infection and those associated with the toxemia, continuous high fever, numerous stool time, containing the blood and the mucus, accompanying with the hiccough and the scanty urine, they all these cases they have a bad prognosis. So I hope you can easily understand what are the prognosis of the bacillary dysentery, right? So we are move on the next point, that is the treatment. So for the bacillary treatment, we just give the rest. Rest is absolutely essential into the bed rest. And in acute cases, the patient should have only the boiled water in sufficient quantity, and glucose may be added to it into the severe cases. We can give the ORS also, and all protein should be stopped till the convalescence stage. So जब तक mucus आता है तब तक हमें protein नहीं देना है, right? and we give the other treatment like feeds. जितने भी खाना देना है वो गर्म ही खाना देना है. Skimmed milk and the milk are the given when the patient has been free from the symptom for about 7 days, as the indiscreet creation into the diet may cause the relapse. So skim milk और milk हम दे सकते हैं, और उसको कब देना है कि जब 7 दिन उसके सिम्टम के जाने के बाद हम दे सकते हैं. हम डाइट में जो फॉलो नहीं करेंगे तो डिसेंट्री फिर से रिलैप्स होगा. राइट. इन chronic cases, a non-irritating diet and the high caloric value is important and should consist of a large amount of the protein. We can give moderate amount of the carbohydrate and only a small amount of the fat. We can give boiled fish, chicken, liver soup, milk, soft rice, and the smashed potatoes are allowed. Apart from this, when we are going to do the pharmacological treatment, we can give the full course of the antibiotics, and we have to replace the fluid which and electrolyte which are drawn by the diarrhea and the dysentery. So we have give the parenteral IV fluids for the correction of the dehydration, right? So I hope you can easily understand what is the causes of the bacillary dysentery, which are the different types of the bacillary dysentery, which are sign and symptoms of the bacillary dysentery, and which are the management of the bacillary dysentery. Now we move on the another part, that is the amoebic dysentery. So amoebic dysentery is also known as amoebiasis. So it is happened by the amoeba and Enterema historylica, right? So let's see the definition of the amoebic dysentery. Amoebiasis is the condition of the harboring the protozoan Entamoeba histolytica, right? So Entamoeba histolytica is the main cause of the amoebiasis or the amoebic dysentery. So how it is a different, we see into the last part, difference between amoebic dysentery and the bacillary dysentery, right? So amoebic dysentery is a subacute or the chronic febrile disease and the diffuse from the bacillary disease, which differs from the bacillary disease, which is an acute disease with sudden onset associated with the pyrexia. So amoebic dysentery acute, subacute हो सकता है और chronic हो सकता है, afebrile होगा, and इसी वजह से bacillary disease से dysentery से differ है, because in the bacillary dysentery there is a fever, right? But in acute case of the amoebic dysentery, there will be a sudden onset and there will be a fever also. So symptoms of the amoebic dysentery may not appear till month or even year after the infestation. एक बार बॉडी में आ गया तो जरूरी नहीं है कि वो तुरंत ही साइन एंड सिम्टम्स देगा, उसके लिए टाइम लग जाएगा, राइट? Let's see which are the etiology. So first etiology commonest, that is the Entamoeba histolytica, right? So it is the responsible for the disease, and it may live for a long period into the lumen of the large intestine without the invading the intestinal wall. वो वहां पड़ा रहेगा, वो intestinal wall को invade नहीं करेगा. When the invasion occur, invasion जब होता है, so lesions are developed into the mucosa, which may give the rise to the amoebic colitis. के बाद में वो colon का inflammation शुरू होगा. So invasion may sometimes occur with only the localized lesion, which do not cause the overt sign and symptoms. कोई एक जगह पे लेजन होगा तो वो sign and symptoms नहीं देगा, but वो E histolytica is a parasite of a man, but occasionally it is found into other animals also. Remember one thing, it is also spread via fecal-oral route, right? Infection is normally acquired by the swallowing the cyst of the organism, passes into the feces of an infected patient and contaminating foodstuff or the water. Again, I said, okay, this is the cause fecal-oral route infection, right? Excistation occurs जब cyst जाएगा, फिर उसको cyst का excistation होगा into the lower part of the small intestine and upper part of the large intestine. वो cyst जो बंदा ने निगल लिया है वो वहां पे स्मॉल इंटेस्टाइन के लोअर पार्ट में और लार्ज इंटेस्टाइन के अपर पार्ट में वहां वो सिस्ट बस्ट होगा. right? So each viable cyst which liberate the 4 nucleated amoeba, which subsequently split into the single nucleated entamoeba, which may survive and multiply into the lumen or invade the intestinal wall. So invading is again depending on the susceptibility of the patient. So under the condition still unknown, but some tropozoites of the organism from the cyst which are eventually excreted into the feces. So ये जो cyst जो होगी tropozoites की parasite की प्रोटोजुआ की, वो प्रोटोजुअल cyst जो है वो again feces में पास होगी. सो वो फिर भी हेल्दी पर्सन वो फीकल ओरल रूट में ट्रांसमिटेड होगा. सो इट इज अ स्प्रेड बाय फीको ओरल रूट. So in general, the diarrheic soft stool contain the entamoeba and the soft stool contain the cyst from which the tropozoites are deliberated. कि वो soft stool के अंदर उसकी cyst रहेगी. So from this infected feces, that infection will be spread. Now let's see which are the different signs and symptoms of the amoebiasis or the amoebic dysentery, right? So sign and symptoms are the disease usually runs a chronic course with the grumbling pain into the abdomen and 2 or more loose stool a day. दिन में 2 बार या 1 बार या 2 बार स्टूल होगा. And the symptoms sometimes resemble those of a duodenal ulcer. Duodenal ulcer जैसे उसके symptoms दिखाई देंगे. Periods of the diarrhea alternate with the constipation are a frequent feature. So again, we are very confused in this case with the IBS, irritable bowel syndrome. So mucus is usually passed and the motions are often offensive in order. Remember one thing, bacillary dysentery are not inoffensive, but here the amoebic dysentery, that is the offensive in order. So on palpation, there may be a tenderness into the abdomen along the colon, usually more marked over the region cecum and the pelvic colon. कि palpation करेंगे तो cecum area और pelvic colon में हमें tenderness feel रहेगा. This is the clinical examination signs, right? The right iliac pain may stimulate acute appendicitis, not a stimulate, it is a simulate acute appendicitis. And if an operation is performed, the amoeba may cause the ulceration of the wound and the surrounding tissue. वहां पे जो ऑपरेशन हुआ होगा तो उसके wound के आसपास वो amoeba ulcer करेगा. So perforation when it occurs usually in the region of the cecum. सो लॉन्ग कॉम्प्लिकेशन में जब वो इन्वेडिंग करेगा और परफोरेशन होगा तो वो सीकम रीजन में ही यूजुअली हमें दिखाई देगा, राइट? सुपर एडेड पायोजेनिक इन्फेक्शन ऑफ द अल्सर may lead to the more acute bowel symptoms with the very frequent motion and the passage of the considerable quantity of the blood and the mucus, and thus it simulate the bacillary dysentery. अब क्या हुआ, जब इमीबा है वो अमीबा अल्सर क्रिएट करेगा. सो वो अल्सर के आसपास नया इन्फेक्शन होगा और नया इन्फेक्शन वो बैसिलरी इन्फेक्शन भी हो सकता है. सो अब वो पूरा कंडीशन हमें बैसिलरी डिसेंट्री जैसा दिखाई देगा. So bacillary and the amoebic dysentery may occur together, and the bacillary infection probably lightening up a latent amoebiasis. So bacillary infection होगा तो जो पड़ा हुआ अमीबा है वो भी जाग जाएगा और amoebiasis पर हमें दिखने को मिलेगा. So but the macrophage is present into the bacillary dysentery and it may be a mistaken for the amoeba. Sometimes macrophage हमें bacillary dysentery में देखते हैं तो इन्वेस्टिगेशन में हम अमीबा उसको मिस्टेकन कर लेते हैं, राइट? More into the sign and symptoms. So early symptoms may be a local discomfort and the intolerance of the fatty food. Later a swinging temperature बढ़ेगा कम होगा, and the sweating and enlarged tender liver and a raised diaphragm with the limited range of the movement on the right side are the characteristically found, and the symptoms may remain vague and signs are the minimal. Symptoms vague हो गए, कोई sign हमें दिखाई नहीं देगा, right? There is usually some increase into the total leukocytes. Total leukocytes आपको increase मिलेंगे. So these are the sign and symptoms which we have to found in the case of the amoebiasis or the amoebic dysentery, right? Now let's see investigation or how can we diagnose the case. So as the sign and symptoms of the amoebic dysentery are often vague, a careful neck eye examination of the freshly passed motion should be made. हमें देखना है. If the mucus is found, a small piece should be selected and examined under the microscope at the once for a amoeba. Right? So we can perform the stool routine and the micro. From this stool and routine micro, if we found amoeba, then we can consider this is the amoebic dysentery. Other investigations like CBC and electrolytes and that all are the necessary in the this case, right? Now let's see what are the complications of the amoebiasis. So first complication, that is the hepatitis, is the most common complication because it is a liver is situated just near to the large colon and cecal area, so it is a very common. Liver abscess occurs into the 2 to 3 cases. Liver abscess common है इसमें. लंग एब्सेस भी हो सकता है, पेरिटोनाइटिस भी हो सकता है और appendicitis भी एज अ कॉम्प्लिकेशन दिखने को मिलेगा. Now let's see what are the prognosis of the dysentery, amoebic dysentery. So complications of the hepatitis and the liver abscess are often prove fatal. उसमें बंदा मर सकता है. And in acute types, it is not unfavorable except into the fulminating and the gangrenous type, where the toxemia and the peritonitis causes the death. Acute में unfavorable कब तक नहीं रहेगा? जब वो gangrenous type नहीं हो जाएगा तब तक वो favorable होगा. But if there is the gangrenous type is there, toxemia is there, peritonitis is there, so case is unfavorable, right? Apart from these two prognosis, in many cases, however, the infection runs a very chronic course for a month and the years and make the patient invalid. बहुत लंबा समय से इन्फेक्शन चलता है, सो पेशेंट इनवैलिड इसके ट्रीटमेंट के लिए हो जाएगा. Right, so this is the prognosis of the amoebic dysentery. Now we move on the treatment part. So again, just like a bacillary dysentery, rest in the bed is a necessary till all symptoms are disappeared. Avoid chill and the exposure. ठंडी में नहीं जाना है. All solid food should be withheld. Patient को सिर्फ liquid पे रखना है. Light fluid diet should be taken such as a milk and barley, milk and sago, thin barley water and lime whey. We can give as a part of the treatment. Starchy food such as the potato, bread, pastry, fat and irritating food and alcohol should be avoided. Bacillary dysentery में हम दे सकते हैं, amoebic dysentery में हम नहीं दे सकते हैं. In chronic dysentery, fruits such as a ripe banana, apple and the papaya are the useful, right? So if we have a constipation in the patient, so banana and apple are to be avoided in the case of constipation. In cases of the diarrhea, pulp of the back bale sweetened with the sugar should be taken in the morning. Right. Apart from this regimen, we can give the pharmacological treatment. We gave the antiprotozoal like metronidazole, ornidazole, and the tinidazole. And just the same like a bacillary dysentery, we have to correct the water and the electrolyte. And we give the parenteral fluid for the correctness of the dehydration, right? Now let's see what are the therapeutics for the homeopathic therapeutics for the dysentery for both bacillary and amoebic dysentery, right? So first homeopathic drug, that is the aconite, a preliminary remedy into the season when the days are warm and the nights are cool in the summer. So fever, hot and dry skin, restlessness, frequent scanty and the bloody stool with the mucus and the tenesmus is there. Bacillary dysentery with the anxiety to pass urine, which is a hot and the brown red color, right? Other medicine, that is the ferrum phos. Ferrum phos may be used in the place of the aconite when there is a greater passage of the blood, and we can use the aloe socotrina also. In that amoebic dysentery, jelly like a mucus stool covered with the blood accompanied by the gripping into the epigastric region. A good deal of the mucus is expelled, बहुत सारा mucus निकलता है. In the chronic cases, sense of the weakness into the rectum as if the stool would escape involuntary. पता ही नहीं चलता है, stool निकल जाता है, and there is a violent tenesmus we have found into the aloes ocotrina, right? Another choice of the drug in homeopathy, that is the arsenicum. Arsenicum, the indication are slimy and the bloody stools, which are undigested, horrible, offensive stool are the blackish brown. The tenesmus and the burning of the anus and the rectum continue even after the stools, which are scanty, and there is great prostration, thrust, restlessness, but no abdominal distension. Is suitable at the late stage when the patient becomes very weak and the dysentery brought by the cold drink or the fruit. We have to think about arsenic. Another drug that is the baptisia. Baptisia will be useful in the dysentery of old people with the low fever of a typhoid type and the pure blood tin coated yellow brown into the center. There is a tenesmus, but with the no pain, offensive discharge is there, and sore bruise feeling all over the body are present, and the tongue is dry. This is the baptisia. Other drug, that is the cantharis. Bloody slimy discharge like a scraping of the intestine. वो scrape किया हुआ ऐसा सब stool आएगा. Tenesmus is a marked painful urination and the colic like a doubling of the patient and the not giving the relief. Pain not ceasing after the stools and the unquakerable thrust. Thrust बहुत ज़्यादा रहेगा. Another one, that is the ipecac. Amoebic dysentery caused by the eating raw fruit or the sour fruit, where a large quantity of the mucus is expelled, slimy blood discharge, sickness, and the vomiting worse in the evening. This is the characteristic of the ipecac in the case of dysentery. Another drug, that is the lachesis. The constriction of the anus and the great offensiveness of the stool indicate this remedy, and the discharge may be a chocolate color, and during the stool a feeling of the burning at the anus is there. So choice, that is the lachesis. Another drug, that is the mercor. In the Mercor, the chief indication is intense painful tenesmus with the bloody stools. Besides, there is a tenesmus in the bladder too, and the stools are scanty with burning at the anus, and the crampy pain continues after the stool. Mercor के बाद Mercsol. In the Mercsol, it is to be used into the mild cases of the bacillary dysentery with a never get done feeling, and the colocin if there is a much colic and relieved by the bending double, patient पूरा मुड़ जाएगा, उसको ठीक होगा. Apart from these two, another are the nitric acid, burning and the tickling into the rectum. Tenesmus is there, pain after the stool. Another, that is the mercurius dulcis. So it is to be used where the tenesmus and pain are the slightly कम है, तब हम mercurius dulcis use कर सकते हैं. Other GIT remedy, that is the Nux vomica. It is to be used into the scanty and the frequent dysenteric stools attended with the gripping pain and the tenesmus which causes after the evacuation. उसको evacuation के बाद tenesmus का feeling होगा. One another, that is the rustox. In rustox, the dysenteric bloody stools with the tearing pain down and the thigh and the back discharge jelly-like bloody mucus and some natural feces. The patient is so restless that the changes his position constantly. The tongue is dry and the rough with the red edges. These are the characteristic of the rustox. And the last homeopathic medicine, this is the sulfur. In the sulfur, the chronic cases where the tenesmus exists all the time and that there is a frequent and the sudden urging to stool, which are the bloody, slimy, scanty, and watery, and the patient is worse in the morning. right? So these all are the different homeopathic medicines we can use into the bacillary dysentery as well as into the amoebic dysentery, right? So friends, once again, thank you very much for listening me, and I hope you have to clear your objectives of the session. What are the definition of the bacillary dysentery and amoebic dysentery, right? Which are the different types of the bacillary dysentery, and what are the signs and symptoms of the both amoebic as well as the bacillary dysentery, which are investigations, which are the management, and which are the homeopathic therapeutics. So once again, thank you very much. And the question for you, which is the full name of the cause of the amoebiasis, you have to mention into the comment. And if you feel any query, you can ask me on the call, WhatsApp, or comments. Thank you very much.